We are here to provide the video presentation of progression of periodontium from healthy state to diseased state. Why do we think that gums health are so important? It's important because of local health and general health. While considering the local health, it's important for chewing, aesthetics, to prevent sensitivity, bad breath, loosening of teeth and even tooth loss, bleeding gums and food lodgement. While considering the general health, it's important for nutrition. Some conditions are affected by gums diseases. While pregnancy, it may cause low birth weight and it may increases the severity of diabetes mellitus, heart diseases, and it may cause irregularity in menstruation. How do these gum diseases occur? There is a food debris accumulation, and due to poor oral hygiene maintenance and improper tooth brushing, there will be a plaque formation and calculus formation, which leads to inflammation of the gums, showing the symptoms of bleeding on brushing and reddening of the gums. If this process goes on, then it will affect the supporting structure of the tooth, that is the alveolar bone and periodontal fibers, leading to recession of the gums and bone loss, and even the loosening of teeth, and leads to teeth loss. This video presentation shows that increase in plaque and calculus formation will lead to an inflammation of the gums, showing the recession and bone loss, and leads to loosening of the teeth, and even the tooth will get fall out. Now let's see the preventive measures for the gum diseases. First is the mechanical methods of plaque control. First and foremost in mechanical methods is the proper brushing habit. Let's consider the brushing of T3 in the upper right quadrant. Place the head of the brush parallel with the occlusal plane beginning at the distalmost tooth, and place the tip of the bristles at gingival margin pointing at 45-degree angle to the long axis of the tooth, and exert short vibratory back and forth movements without dislodging the tip of the bristles. And slide the bristle towards the biting surface of the dentition for all the tooth surfaces. Do this on the opposite side also. Do this on the inner tooth surfaces of the upper dentition. For cleansing the plaque on the inner side of the front teeth, place the heel of the bristles on the inner side and do the vertical strokes towards the occlusal surface of the teeth. Do the same for the lower dentition also. Repeat the procedure on the inner surface of the lower dentition. For cleansing the plaque on the inner side of the lower front teeth, place the heel of the bristles at the gingival margin and do the vertical strokes towards the biting surface of the lower front teeth. Do back and forth movements on the biting surface to remove the plaque on this area efficiently. This should be a very gentle motion, should not cause any pain. Brushing too vigorously or with large strokes will cause damage to the gums tissue. Replace your toothbrush once in every 3 months because one brush will cause damage to the gums. The second mechanical method is the interdental aid. The first interdental aid is the dental flossing. Take a dental floss of about 12 to 18 inches long enough and wrap it around the fingers and stretch it between the thumb and forefinger or between both the forefingers. Then slip it across the contact area. Do not snap it because it may cause damage to the floss. Then move the floss firmly across the contact area and beneath the gingival margin, and then bring the floss again up to the contact area. Do the stroke for about 2 to 3 times. Once it done, move the floss across the interdental papilla and do the same procedure on the adjacent tooth surface. Repeat the same procedure throughout the mouth. Another interdental aid is the interdental brushes. There are two types, single tufted and multi-tufted. It should be selected according to the interdental spaces. If there is a tight contact area, then we have to use a dental floss. If there is a small gap between the two teeth, then we can use the multi-tufted brush. If there is large space between the teeth and there is an absence of papilla, then we have to use a single tufted interdental brushes. This will remove the plaque efficiently in the interproximal area. The third interdental aid is the bridge cleanses, which can be used to remove the plaque under the fixed dental prosthesis. The third mechanical method is the oral irrigators. It removes the plaque or biofilm more efficiently than the dental floss. It can be used both supragingivally and subgingivally and can be used in individuals with special oral health needs. Now let's see the chemical methods of plaque control. First is the use of mouth rinse. Use mouth rinse half an hour after brushing. Do not eat or drink half an hour after gargling. Some mouthwashes need dentist prescription to avoid the side effects. The next chemical method is the use of disclosing agents. It stains the invisible plaque located on the tooth surface and helps in patient motivation and also for efficient removal. It also available as solutions and wafers. And the last and most important preventive measure to be taken by the patient is the regular dental checkup. Visit dentist once in every 6 months because early detection of any oral diseases is the most important preventive measure. Thank you.